The South Korean health paradox. The Korean paradox sounds shocking: high salt, low heart disease, but the conclusion that extra salt might be protective is very likely misleading. Here's what's really going on. First, sodium alone doesn't act in isolation. South Korea's traditional diet is high in fermented vegetables like kimchi, but it's also rich in potassium, vegetables, seaweed, legumes. Lower in ultra-processed foods, higher in fiber, lower in added sugars. Historically lower in obesity rates, potassium counteracts many of sodium's blood pressure effects. So high sodium plus high potassium is very different from high sodium plus processed food. Second, observational quartile data can be confounded. People eating the most sodium in Korea may also be younger, more physically active. Eating more traditional whole foods less likely to be obese. That creates a correlation, not proof that salt protects the heart. Third, population-level data worldwide consistently shows higher sodium intake increases blood pressure in most people. Hypertension remains a leading cardiovascular risk factor globally. As for the 40% drop in heart disease mortality, from 2000 to 2019, that period also saw better medical treatment, improved blood pressure control, more statin use, smoking rate reductions, expanded healthcare access. Those factors alone can drastically reduce mortality without changing diet. There is no strong clinical evidence that excess sodium protects against hypertension, heart disease, or stroke in the general population. What the Korean paradox likely shows is this: dietary patterns matter more than single nutrients. Context beats headlines. High salt inside a traditional plant-heavy diet is not the same as high salt inside a processed Western diet.